compared to the previous community forum that we had. As you can see from this, in the middle of the slide, you can see the chart that shows that we've been at a plateau for a while, and now actually our numbers are beginning to go down. We are at averaging about 500 to 600 cases per day. And our percent positivity has also dropped a little bit to 10%. It was above 10% for a while. So I'm not going to talk for long because this time we have the pleasure of actually having an additional person join us, Dr. Cohen. I've known Dr. Cohen for as long as I've worked in Sacramento County. I respect him highly. He is one of the infectious disease specialists at UC Davis. We've worked together through a lot of outbreaks, and we've worked through COVID-19. With each case that came in, we worked together on it. So very pleased that he's joining us tonight. And I'd like to ask that you take the advantage of asking him all your clinical questions. And of course, we also have Rachel Allen, our immunization coordinator, and she will say a few words about where we're at with immunization. And then we'll go into questions. Thank you.
So I was going to thank everyone for inviting me to this forum. I am an infectious disease doc at UC Davis. I've been at UC Davis since 1981, actually, and it's been a long road. I think we were involved in diagnosing the first case in Sacramento County. It's been a road that has had very little breaks in the action, so to speak, as things have gone on. We're also seeing a decline in the number of hospitalized patients and the number of patients in critical care units over the last couple of weeks compared to where we were. We're down about a third of the number of cases that we have had in the hospital. And so we've been involved in developing treatment trials. We've also been involved in vaccine trials. We're currently doing another vaccine trial. I think vaccination is the key to the end of this pandemic, and the more vaccine that's available, the faster people can get vaccinated, the better off we're going to all be, and we'll move things forward. And I'll stop talking.
Hi all, this is Liz Gomez. I noticed some questions about how to hear our fabulous panelists. You have an interpretation bubble at the bottom of your screen, and if you'd like to hear the panelists in English, that should be the default language. However, you can click that bubble and make sure that it's selected in English. Just want to make sure folks can hear our panelists. If you can't hear our panelists, and there are many people who are having this issue, please continue to put that feedback within the Q&A.
Rachel?
Right, again, I'm Rachel Allen, the immunization coordinator for Sacramento County Public Health. So thank you for having me. This is my second time back. And so did you want me to give an update now, Mike?
Yeah.
Okay. Yeah, so for those of you who weren't on 2 weeks ago, I'm a nurse and I am the coordinator over the immunization program, and we normally support immunizations, work with schools and clinics, and even go out and provide immunizations to support keeping the herd immunity for Sacramento County. So we have a big role in, of course, the rollout of COVID vaccine, and we share Dr. Cohen's enthusiasm that this is the hope that we've been waiting for and hoping for. So just a quick update, and I think we can answer a lot of things in the questions, but We are still vaccinating in phase 1A. So those are the healthcare workers. I think when we met 2 weeks ago, we shared that we thought that would take the better part of January. And I think we're on target to meet that goal. Yeah, there's our website that shows you who we're vaccinating now. So everyone in phase 1A, tiers 1, 2, and 3. And this week, well, you may have seen last week on the news or not, I'm not sure, the governor came by Cal Expo. So a big focus for us this week has really been working on scaling up Cal Expo, which is a site that public health is putting together. And moving that from a smaller operation to something that's going to be really substantial and kind of sustained through the response for our community. I was out there today. It's looking amazing. We have some people that have really helped to design it. And if you ever went out for testing, it's going to look different if you come through for vaccines. Lots of lanes. We have the help of the National Guard out there, which is really fantastic for our community. And so just a terrific effort from public health to put that site together. But we're looking at other sites too, and lots of other sites. So continuing to enroll providers. I talked about that last time. There has been a little pause in enrollment because the state was shifting websites, and we're still waiting for the new site to really be up and live. But continuing to try to enroll providers. This is going to take a lot of providers to make this happen. And of course, right now we're working with the larger providers for the most part. And partly because we don't have a lot of vaccines. So we're trying to make sure we can sustain some of the larger operations that have the throughput that we need. So we're running the vaccine site there, working with other partners, and then looking ahead to when we can vaccinate the general community. So working with Mike and others to make sure that we're looking all over Sacramento County, choosing sites that are going to be equitable and provide access for people. So definitely looking ahead, but staying very busy right now, working through phase 1A.
Thank you, Rachel. So with that said, I'm gonna start our first question of the night. A community member asked, since with the vaccine, there's still approximately 5 to 6% chance of getting COVID, are gatherings of people safe to attend? What are the odds of getting COVID at such type of events? Sorry, that was 2 questions.
Right now, especially since we still have pretty widespread COVID-19 infections in the community, we still advise that you avoid gatherings with people outside of your household.
Another community member asked, how will the 65 and over be contacted to schedule vaccine shots?
Rachel, do you want to take that one?
Sure. Yeah, so we're looking ahead to that. I think a lot of people are, that seems to be the most popular question, and rightfully so, as I know the governor said that California could move forward and vaccinate the 65 and over population. Like I said, Sacramento's still working through that phase 1A, so we haven't made the official shift to the 65 and over. We certainly have a lot of providers, hospital systems and other providers that we're working with who do have vaccine. And if someone who's 65 and over is able to, who presents for an appointment, we're saying, yes, go ahead and vaccinate. But we have not made the move yet to those folks in that population. When we're ready to vaccinate, and we really are waiting for vaccine, we need more doses. We'll make sure that it's very clear how people can be vaccinated.
And along those lines, there are a few questions here, similar, asking about teachers. Is that the same case for teachers?
Yeah, so we're working through those phases and tiers that CDPH gave us, and we're following the allocation guidelines. And so teachers were in the phase 1B. We're just not there quite yet.
Another community member asked, what are the possible effects and what side effects, and what should one do if a person has a first of the 2 vaccine shot?
We'll let Dr. Cohen take that.
So I can take that. So the number of adverse effects have been comparatively limited. Most of them are local. Most of them are sore arms and maybe some redness around the site, but mostly sore arms. People feel a little bit tired. they may be a little bit achy, get muscle aches. Rarely do people get fevers, at least in our healthcare worker experience. And then I think everyone is aware that there are occasional episodes of anaphylaxis, but those are really, really low. I can't remember the exact numbers, but it's like 1 in 800,000 or something along those lines. So it is quite an uncommon scenario. The symptoms are sometimes a little bit worse with the second dose as people get a booster. But again, our healthcare worker experience has been that it's been comparatively limited as far as enough to make people not come to work the next day. I think taking Tylenol or something along those lines is perfectly good. I've been telling people to preferentially use acetaminophen as opposed to anti-inflammatories like ibuprofen because there have been some animal studies that suggest that it may blunt the immune response a little bit. So unless people have significant problems with acetaminophen, I would use that as the first choice. And then if it doesn't work, you got to make yourself feel comfortable and get through the days. And the potential risk is, I would say, is pretty low. It's just if you have a choice between one or the other, pick the one that's not the anti-inflammatory. Is the way I look at it. And I think, the other question that sometimes comes up is whether there are long-term effects of the vaccine and how this plays out as people balance their decisions. And the answer is we know what's happened 3 to 4 months after vaccine injections because that's how long the studies have been ongoing. So we don't have any information for particularly long-term outcomes, except that with every other vaccine, most of the complications occur within the first several days, not even several weeks. And so the expectation is that that's not going to be the case. And whenever people are vaccine hesitant, we always remind people that even patients that survive or have relatively minor cases of COVID are way more likely to have long-term complications than anybody getting a vaccine, right? It's not even a close race to balance.
Thank you. A community member asks, are we, as Sacramento County Public Health, going to create a dashboard in terms of vaccines?
Yes, that's our intent. But right now, since we're still in the early stages of our rollout and making sure that the numbers we have are good, because there is a delay with once the data is inputted to actually be able to access it. So I want to make sure that all of that is worked out before we set up the dashboard.
Another community member states, the ICU availability is about 8% now, less than 15%. But why is the region able to exit from the stay away at home order by the state?
So the decision to exit the stay-at-home order was based on a projection. The state on a weekly basis does a 4-week projection of what they think the ICU capacity is going to be, and it's based on some modeling. And it's also based on factors such as looking at how many cases are coming in and how the number of hospitalizations. And based on that, the state determined that our ICU capacity for the region would go up to 19% by the end of the 4 weeks. So that was what the decision was based on.
Another community member asked, how can we expect the vaccination campaign to change starting with President Biden's new executive actions today?
We do know that there was a new plan that was released. It's 200 pages. So no, I have not read it. Though I think what we know in general from the reports that we've heard is that there is going to be more of an effort to have a national strategic plan for being able to roll out the vaccine, and also a plan to increase the output of vaccine, because that's been one of our greatest problems, is having enough vaccine to be able to get to all the groups as quickly as possible. And also there will be a focus on equity, in which in California we've already been working on.
Matthew asks, how are we looking for the UK and South African variant or new mutations? And are the tests being positive test cases being fully sequenced in the county?
For the county public health, we are not. So I don't know if Dr. Cohen has more to say with what they're doing at UC Davis.
Yeah, so right now, we aren't either, but we have one of the scientists over on the Davis campus is developing a rapid sequencing system, and we're starting to validate clinical samples. So the goal will be to be able to sequence all the clinical samples coming in and trying to identify any of the variants that may pose some difficulties. But at this point, we are not actively looking. Takes a little bit of time to get these systems up and working, so you know that you have valid results.
Since we have many clinicians, amazing clinicians in the room, a question is asked, are there any recommendations for any over-the-counter supplements treatment for people who are waiting for COVID results, such as zinc, vitamin D, etc.?
So in randomized trials, those drugs have not really helped. I don't think zinc or vitamin C is going to hurt anybody, but there's no, at least objective data that they provide any benefit.
Are there any thoughts on why California is behind on vaccination compared to other states?
So there are a number of factors there. One is that I think actually part of it is a data issue, because as I mentioned, our databases, there's a lag between the information getting in to actually being able to produce reports. I think a lot of it also is dependent on the rollout. In California, there was a lot of focus put on being able to follow the tier structure and the phases. And I think that over time, the state has actually pulled back on that and tried to make it easier for us to get through. And right now with phase 1A, we are doing all of the tiers. And again, also recall that the vaccine started coming in at the end, during the holiday season at the end of the year. And so with the local health departments, which is where many of the doses are going, our greatest push was after the holidays. And so right now, when you look at all the different health departments, many of them have set up mass vaccination clinics, and it takes a little bit of time to ramp those up. So I think that now we've probably caught up, but I think the data there's a lag, so it might not show quite yet.
Another community member, Elaine, asks, how are allocations to the counties made by the state?
You want to take that one, Rachel?
Sure. Yeah, so each week the state has a formula that they use, and there's various factors each week. So the allocation changes. So some weeks we've had more vaccine because those are weeks that vaccine is not being given to the partnerships with the pharmacies that are doing long-term care. And then some weeks we have less vaccine because a chunk was taken off the top for the long-term care facilities. So we're hoping as that program continues to progress that we will be able to have increasing allocations in the weeks and months to come. But there's still quite a variation, and we really don't know. We know about a couple days ahead of time. We really know week to week, just 1 week ahead of what we're going to be getting the following week.
Another community member, Sarah, asks, once you're vaccinated, can you still spread the disease?
Dr. Cohen?
Yeah, I'll take that too. So I think the answer is going to be no, but I don't know that answer right now. So the way that these studies have been done is they are involved particularly in preventing symptomatic disease. So if somebody comes in with respiratory symptoms, gets tested and turns out to have COVID-19, that would be considered an endpoint, and that's how those vaccine efficacy data are collected, right? That's how you know that it's 95% effective in preventing disease. There are samples that are taken in most of these studies over a variety of times, and that data should be ultimately available. But at least at this point, I cannot say for certain that it is 95% effective in preventing infection. And so at least until that's totally clear, it makes sense to be cautious. But with all other viral vaccines, when they work, they prevent infection. And so the expectation is that's what it's going to be. We just don't have exact data at this point. And so the masking and social distancing and everything else still seems to make sense until we can officially say we know that 95% means 95% don't get infected.
Thank you. I guess another question to Dr. Cohen. Can you explain a little more about the vaccine and particularly the spike proteins within the body's own cell and the process of the vaccine?
Yeah, so a couple of things that I think many people are not aware of. So these two vaccines that are available right now, the Pfizer and Moderna vaccines, are the first two vaccines that are so-called mRNA vaccines. So they use a piece of genetic material from the virus that produces the spike protein, and I'll talk about that in a second. And that technology was developed about 20 years ago when COVID's predecessor virus called SARS actually was starting to cause a pandemic, albeit it was mostly focused in Asia and in Canada. And so that technology was developed back then. Everyone knew what the target protein for coronaviruses were going to be based on that information. So I think the idea that the vaccine was rushed out doesn't really know the backstory, that this stuff was being developed all along. Now, these particularly small pieces of genetic material that produce that one protein get put into a capsule, which is then injected in the body, and then cells take that capsule up and release the RNA, which then produces the spike protein. The spike protein is what makes a coronavirus look like corona. It's sticking out of the cells, and that's what attaches the virus to our respiratory cells. And that is the primary target for our immune system. So, and what happens is those cells end up releasing some spike protein, and then some of it actually stays in the cell and is sort of sitting on the surface of the cell to try to generate that immune response. Once those spike proteins are made, the RNA is destroyed. So there's no genetic material that's lasting in your body for any significant period of time. Once it's done its job, it's gone. And the proteins are there. That's where you're developing the immune response. And I think that probably covers most of it. The other vaccines that are in line for development use slightly different mechanisms, but they all use the spike protein as the primary target for the immune response. And by the way, that's one other hope for getting more vaccine out, is that there are 2 more vaccines that I think the clinical trials are either done or close to done. And so we may have some information, and that should increase the availability of vaccine and allow for more widespread distribution. 2 companies, it's hard to make enough vaccine to vaccinate the whole country in a short time period.
Thank you, Dr. Cohen. So I'm looking through and scrolling through many of the questions, and a lot of folks are asking, I'm 75, I'm 85, when can I get the vaccine? So I'm gonna pause us for a moment and go back to this tier sheet and kind of go through and have Rachel again answer some of the questions, what tier we're in right now. Once it's available for older adults, when and how would they be contacted?
Sure. Yeah, so we're still in phase 1A. You can see the vaccinating now. And phase 1A really is people who work in healthcare who have exposure to COVID through their work in healthcare, and also residents of long-term care facilities. We hope to be moving to phase 1B towards the end of January. It really is dependent on the doses that come into Sacramento County before we can really make that commitment. There's a lot of people in phase 1B. It's a very large group. Phase 1A was also a large group, so it took some time for us to get through. And that's also why you see, different counties moving at different paces. Smaller counties don't have as many people. So, but we will be moving to that phase. And when we do, there's going to be a variety of ways that people 65, 75 and over can be vaccinated. One, certainly we hope will be through their primary care provider, but for those who don't have the vaccine access that way, we, Sacramento County, we will be sure that the message is very clear how they can be vaccinated.
And with that said, is Cal Expo the only site for vaccination?
No, so we're partnering with other sites. So people may have seen or heard that Cal North State is doing a pod, as well as Sacramento State is just starting this week as well. Really fabulous partnerships and opportunities for their own pharmacy and nursing and medical students to be a part of this response. So we're really happy to work with them. And we're working with pharmacies as well. We're working with the FQHCs and we're continuing to enroll providers. And we want to continue to enroll providers. Again, there just isn't enough vaccine to give out to everyone right now. So we're having to really be careful about the decisions that we make and make sure that the vaccine is going to the sites right now that we know can get the doses out quickly. And the goal really is to try to move as quickly as we can.
Thank you, Rachel. And thank you, Liz, for sharing that flyer. With that said, another community member asked, they notice other counties are vaccinating different tier groups. Is it fair to say that we should compare ourselves to and vaccinate with the tiers that other counties are doing?
Maybe I'll take that one. I think one thing to recognize is that each of the county has a different size, and most of the counties that surround Sacramento County are much smaller. So they were able to get through their phase 1A pretty quickly and move on to others. The other thing also to note is that because Sacramento County is the capital and does have a lot of people who work here for the state, for the federal government, as well as who work here but live in other counties, we do actually provide vaccinations for all of these groups. So we do have a much larger group that we need to deal with. And again, because of the way that the systems might be set up, we try to go at the same pace, but you will find that there is some variation in terms of some counties have been able to start phase 1B vaccination before Sacramento.
Another community member asks, are Save Mart, Safeway, Urgent Care Now official vaccine administering sites?
So we're partnering with we have various partners that we've are working with, and so we can only work with the ones that are in our system. So we only have 50 providers right now in the system, and we are trying to work with providers who can, like I said before, kind of reach the broadest, kind of working in a geographical area, but also pushing through the most numbers as quickly as possible. And also we have to take into account that not every provider can handle both. You know, the two different vaccines have different storage and handling issues and requirements. So for Pfizer vaccine, it even narrows even further the providers that we're able to work with. So we try to look really carefully and make very judicious decisions with the limited amount of vaccine that we have.
Is one vaccine better than the other?
I think the best one is the one you can get.
One community member says, I've been told not to take ibuprofen. Is aspirin okay? And can people with chronic kidney disease, not on dialysis, get the COVID vaccine?
Yeah, I think you can. As I mentioned, I think there at least is some suggestion in animal models that taking an anti-inflammatory may decrease the amount of antibodies that your body makes to the vaccine. But those data are really not fleshed out. And if you need these meds, you need these meds, right? And so that you just have to take what you have to take. It's only a question of whether when you have a choice, choose something that's less likely to affect the vaccine.
Another community member asked, how are you identifying population, community, location, which have been disproportionately impacted for vaccine needs sooner than later? And there's other questions. How would they be prioritized with the current plan, such as a tier? Will you be involving community-based organizations?
So the answer is yes, we will be involving community-based organizations. We are looking at potential sites, but have not made decisions on any because we would like to be able to get input from our community members in terms of where would they like it. In terms of where it would fall as we go through the tiers, because now the state has said that those 65 and older can start receiving the vaccine. I think we will be doing some limited outreach and limited vaccination clinics to some of our disadvantaged communities at this time as well. But it will really come into full play once we go to the general public, because we would like to be able to get the vaccine to even those that may have difficulty with transportation, or people who may not have a medical home and are not able to go to one of the other providers that has the vaccine.
Eileen asks, has Sacramento County identified any of the COVID variants, UK, South Africa, or any other mutating variants?
You know, I'm unaware of that, but I think you should think that it's here, right? I know that makes people nervous, but these viruses mutate. I think that the assumption should be that it's probably here. It's probably everywhere. And I think all the more reason to get vaccine out.
Do providers such as Kaiser and Sutter get their vaccines through the county, or are they allocated separately by the state or some other organization?
I can answer that. So the state decided early on that they would do the allocating to those larger hospital systems. So the vaccines that go to those systems are allocated directly from the state. We do work with the hospital systems. So on occasion, we have asked them to vaccinate a sector from a tier. And then when that happens, we have the ability to allocate them, but it's not a common occurrence. So it's usually done through their health system from the state.
How long will the vaccination last?
Well, you know, what we know right now, even with natural infection, is that immunity lasts at least 8 months. And that's part of the answer is related to how long this disease has been present and how long we've been able to track people after they've gotten infected. So with natural immunity, it's at least 8 months based on most recent data. I'm assuming vaccine will be equally good. It'll probably be longer than that. But you know, you can't overreach what actually exists.
Anna asks, what is currently the best form of protection against COVID-19?
That's an interesting question because it actually requires using the different methods of prevention. So that is why when we're putting our messages out, we talk about social distancing and face covering and avoiding gatherings as ways of preventing disease. And of course, now that we have the vaccine also, that's an additional one. And our hope is that as we get to herd immunity, that we'll be able to set aside the social distancing and face covering. I don't know if Dr. Cohen has anything more to add to that.
No, I agree. I totally agree with that. But until the population's vaccinated, I totally agree. You know, there actually are studies that have been done looking at counties where they mandate masking versus those that don't. And the rates of infection are markedly different, with the rates being significantly lower when vaccines are, or when face masks are mandated. So these methods do work. They're not perfect, but they really do work. And that's what we have to do until, yeah, we get up to 75 or 80% of the population being immunized or being immune. That's what we have to do.
There are few volunteers and grateful medical volunteers, such as retired RNs and retired physicians. They're asking, how can they volunteer and become and support the county with vaccination?
The best way for us is that if they can sign up with the Medical Reserve Corps, and hopefully Liz can put that link in the chat, because the Medical Reserve Corps will do all of the background checking and all the paperwork, and then they can come and assist us, especially once we get more vaccine and are ramping up and are able to have additional sites.
Again, with vaccination question, they're asking, are everyone in the vaccine phase 1A, I'm gonna pull up the chart, vaccinated?
So, like I said, we're still trying to tie up our work in that in phase 1A. And keep in mind, we will never be all the way done because more people will come into those jobs perhaps that haven't been vaccinated, or some who haven't been vaccinated might decide that they want to be. So, even when we move to phase 1B, we're going to still be doing work in phase 1A, but we're getting close. We do feel like we've reached out to the majority of those people in that phase. To invite them to be vaccinated.
And currently, our just to do a temperature check, we're going to pause right now. Rachel, if you could clarify, because there's a lot of more questions coming in, where we are and which tier, which phase in the county.
Yes, so it's very tiny for me. I think I need new glasses, but we're vaccinating phase 1A. So where it says vaccinating now, all the boxes that are checked. So tier 1, those were people that work in acute care hospitals, people that live in long-term care facilities or work in long-term care facilities. We also were doing people that work in psychiatric hospitals, paramedics, and people working in dialysis. We're also doing tier 2. So that was looking at home health care, community health workers, people working in community clinics, and also public health staff, staff at FQHCs, and then also tier 3. So that was people who work in specialty clinics. We were looking to vaccinate people who work in labs, also dentists and all of the people who work in the oral health field, all of their staff, and people, pharmacists as well. There you go. So that's that's the sum of phase 1A. It's a lot of people for Sacramento County. We have reached out to these groups as best we can, and we're still continuing to wrap up the last of those invitations, and think that we're on track to get that to a place where we feel like we can move on to phase 1B by the end of January. Again, waiting to have enough vaccine to take on that next big group of people.
So just to clarify, we are not in phase 1B, tier 1 and tier 2 yet.
Not yet.
But soon.
Very soon, yeah.
Thank you. Babette asks, can you explain why people with high-risk conditions like diabetes and obesity have increased likelihood of serious illness and death?
Presumably that relates to some immunologic problems, particularly in people with uncontrolled diabetes. They're more prone to infections in general. And I think more importantly, that's what we've seen. So when people have started looking at the cases, those groups do end up having higher risk for more severe disease. And so the exact mechanism presumably is immunologic, but the epidemiology just supports that is the fact.
And I apologize, I didn't finish the other part. They're trying to ask, why are individuals with high-risk conditions in a later phase compared to an earlier phase, such as phase 1C, while industry workers in 1B and 1C? So if someone could further explain the various tiers and how it came to be.
That is a good question. The reason that the tiers came up the way that they were, if you look at phase 1A, especially tier 1, they were looking at those that are at the highest risk. When you look at our death rates, those age over 65 constitute about 80% of the deaths in Sacramento due to COVID-19. So that was part, and 50% are in people in congregate settings, in especially long-term care facilities. So that was the thinking behind selecting long-term care facilities as well as people in healthcare, because in healthcare they're dealing directly with people who are sick, who have been admitted with COVID-19. And then after that, there was decisions made based on what the perceived risk was. Yes, I do hear what you're saying in terms of the increased risk with some of the chronic diseases. and putting them at an increased risk, and that's why they were put, I think it is in phase 1B and 1C. So the people who made the decisions, that's the way it came out.
You know, one other reason that healthcare workers were at the top is you have to have healthcare workers to take care of patients coming in. And so the effects on healthcare workers are amplified because if you've got a bunch of healthcare workers out, then patients don't get appropriate care.
Another individual asks, are we vaccinating in other individuals from other counties at the expense of our own population?
So I can answer that. When the vaccine is allocated for phase 1A, it was allocated for the healthcare work in Sacramento County. So in this case, that's Sacramento County. So that's why that decision, was made that way. Those people work in Sacramento County. We need them to be healthy to take care of the sick people, like Dr. Cohen was saying, in our county. Otherwise, we do that people are, we want people to be vaccinated in the appropriate county. We do try really hard to get that message across and have people, if they work in healthcare in another county, to try to be vaccinated there.
Another question is, can you comment on some of the symptoms that have occurred among the so-called long haulers?
So the long haul kind of symptoms have been mainly respiratory, and there's been some blood pressure issues, particularly with positional changes, and just significant deconditioning. I think a lot of places that are caring for long-term COVID patients, I think the term is now called long COVID, are doing it with a multidisciplinary team, including physical therapists and social workers and other groups to try to address the issues, because a lot of the issues with blood pressure and heart rate and things like that, they're modestly manageable, but most of this doesn't require medicine. Most of it requires just building people back up and getting their strength and energy back. It's a major issue.
And we're not in phase 1B yet. How are some folks belonging to this phase vaccinated through some of their partners?
I guess we would have to know exactly what is meant by that. I know that we have given some vaccine to the paramedics, and they are beginning to vaccinate like people in the fire service. And as Rachel mentioned, soon we are going to start with first responders. But in general, no, we have not yet officially moved into phase 1B. Some people also might have gotten vaccinated for different reasons. For example, we have had some people who volunteered for different vaccine clinics and got vaccinated because of that. And then there are others who have gone to other counties and gotten vaccinated that way as well. Say if they live in Sacramento but work in another county, that could be the reason why they got vaccinated.
What therapeutics are available now while waiting for the vaccines?
So for people who have been who are hospitalized, the two primary drugs that we use are remdesivir, which is an antiviral drug, and then dexamethasone, which is a steroid. And dexamethasone, particularly in people who are on ventilators, has been demonstrated to decrease mortality. And then for less sick people who are outpatients, there are injectable monoclonal antibodies, which have been given emergency use authorization through the FDA. And those are available. I think there's been some concern that they've been underutilized. I know that at UCD, we have a whole system put together to give the monoclonals, but I'm not sure where other community members would be able to necessarily access that medication if the health system that they work with hasn't developed something like that, or they don't have a specific healthcare system that they work or that they are cared for. So those are the options. For inpatients, there's an antiviral drug and an anti-inflammatory drug, and for outpatients, it's mostly monoclonal antibodies right now.
With that said, that's very clinical, I guess. I know that this question was asked earlier, just a gentle reminder as I'm scrolling through the Q&A. What can community members do now to protect themselves from COVID?
So, so I will say what Dr. Kasirye was going to say as well. Wear a mask. Don't congregate in big groups. Keep your distance. Wash your hands, although that's a good thing in general and probably is the least important component of that triad to prevent COVID. So I mean, when we talk to people, most of the cases end up being picked up when people are not cautious and they're in big groups and there's a lot of transmission. That's what seems to be the biggest risk.
Thank you. Can someone explain what herd immunity is?
So I will do my best. I know we're trying to keep the answers short. So here's the deal. When a virus like the virus that causes COVID is passed around, for every person that's infected, they infect 2 to 3 more people. The way to get rid of a pandemic, the way to stop transmission of viruses, to get that number down below 1, so that for every person who's infected, they infect maybe you need 10 people to infect 1 more person. Then those curves are going to go down, the transmission is going to go down. So the way that that works is if everybody around you is immune, then you can't transmit it. But there doesn't have to be everybody in the population that's immune. So what herd immunity means is that there's enough people in the population to just cut transmission so that those numbers can't go up, they have to go down. And for COVID-19, the expectation is that it's going to be about 3/4 of the population that have to be immune in order to stop transmission. So I hope that's understandable.
So following that, does staying isolated and wearing masks help us reach herd immunity?
Go ahead.
Yeah, so no. So the masks don't help you reach herd immunity, but they protect you until you get herd immunity. When herd immunity is present, presumably as Dr. Kasirye mentioned earlier, right, you're going to be able to get rid of the masks. You're going to be able to go to a restaurant and sit inside and have a party and potentially and not transmit. Right, that's what herd immunity provides. For old people like me, you know, everyone got measles when I was a kid. Now, when there's a measles outbreak, it's front page news, right? That's what herd immunity means. that's how you get rid of these infections within populations. Same with polio. All these things that for older folks were present when we were kids, they're gone now, or pretty much gone, and that's what we're looking to do here.
Another community member asks, for vaccine not to go to waste, I'm going to rephrase this question. Is there a wait list for the general population? And if so, how can you get on that wait list?
So we don't have a wait list for the general population. We rarely have extra doses. We're really careful to take only the doses that we have registered patients for a clinic. So sometimes at the end of a clinic, there is an extra dose, and we do try to find someone who's just in close proximity. I'm not sure if we would do more as we're expanding to more clinics, but right now it's just 1 or 2 sites. And so we're not, it's really not enough doses to warrant having a community list just yet.
What are the comparative risks for outdoor activities such as youth sports or running if you are closer than 6 feet apart?
So in general, being outside does reduce the risk. That's one thing. But when you are doing exercise because you're breathing more, that means that, or harder, that probably, if you have the virus in your breath, it would probably travel a longer distance. That's the reason why we are still not able to allow, especially the youth, to resume their sports because of the risks with especially the heavy exercise. And I think for many of the sports, it would be difficult to wear a face covering while you're engaged in those activities.
Trina asks, can the virus enter the body through the eyes or just the nose and mouth?
So it probably can enter through the mucous membranes in the eyes. Again, that's a very inefficient way of transmitting, getting it on your hands and then rubbing your eyes. But it is potentially transmissible. That's why we tell people to wash their hands and not bring their hands to their face. But the real transmission is through the nose and mouth.
Are HEPA filtration systems helpful for home uses? And I'm assuming that these filtrations for the virus.
Yeah, so you want to take that, Olivia? It looks like you unmuted. Go for it.
I'll try. So we do use HEPA filters for in certain conditions, such as when we are dealing with an infectious TB patient. So we do know that HEPA filters are of value, but outside of using them in that setting, we don't have any general recommendations. I know that that's a question we've been asked a lot about for schools and for other rooms. I think part of the issue is that the HEPA filter, its efficiency is also based on the size of the HEPA filter as well as the size of the room. And if you are dealing with a room that's open, or like a classroom where people are going in and out, it might not be as effective. It is effective when we're using it in the hospital because it's very controlled. You keep the room closed and then you have the HEPA filter, and that's the only way that air is going in and out.
Yeah, part of it is the quality of the unit, part of it is the size of the unit, part of it is the size of the room. And one of the things that the HEPA filter does do, besides filtering small particles out, is it increases the number of air exchanges in the room. So, so part of the reason that we like people being outside as opposed to inside is that there's a lot of dilution when there's air movement outside, and it decreases the amount of potential virus that you can be exposed to. So, so in addition to actually filtering, it's going to change the air exchanges in a lot of schools, and for that matter, some of the older hospitals or older rooms are not built to the kind of standards that currently are built, and the air doesn't move. And if the air doesn't move, the virus just sits there, and that's how you end up getting these cluster super spreading events.
There's a question about the governor has announced all 65 plus should be prioritized for the vaccine. Does that mean that phase 1B is merged? No more stage 1 and 2 stages?
I guess it helps to unmute. From what we understand is that when the 65 plus were prioritized, what they envisioned was that instead of in phase 1B going to the 75 plus, is that you would actually go to 65 plus instead. So it does not do away with different tiers or phases, but it does move them up in priority.
Are 2 masks recommended? I see a lot more people wearing 2 masks. Are these recommended by most experts?
I see that too, and I'm not sure where that practice started. But I actually even see that, you know, the press secretary yesterday did her first press conference, and she took off her mask and there was an N95 underneath it. So, so I'm not sure I understand that concept. What I've been told by my colleagues is that the surgical mask protects their N95 and keeps it viable for a longer period of time, but I don't know. I'm not enthusiastic.
Okay, I see a few more questions about the tier. Again, just to Aunt Sue and our tortilla maker, which phase. So with that said, I guess I'm going to bring it back to Rachel and bring up the screen again to see which phase and tiers we are. So with that said, if Rachel, you could share with everyone which phase we are now vaccinating.
We're vaccinating phase 1A, all tiers. So tier 1, tier 2, and tier 3. It encompasses people who work in healthcare and also residents of long-term care facilities and staff at long-term care facilities.
So are we in phase 1B with people 75 plus and older?
Not just yet, but very soon.
And then once we are ready, how are individuals 75 plus be outreach to?
Yeah, there'll be a multiple methods. I think their providers will reach out to them if we have vaccine to give them, but public health will have strong communication as well.
Thank you, Rachel. Can we get a vaccination from another county outside of Sacramento County, even though we live in Sac County?
It's not really encouraged unless you actually work in that county, then yes, you can get your vaccination there if you are in the appropriate phase.
Are we doing contact tracing?
Yes, we still do contact tracing. It's been kind of not being emphasized a lot right now, especially when we had really high rates of transmission and widespread disease. And that's because oftentimes, because the way that we do a case investigation and contact tracing is you ask the person, where were you in the last 2 weeks? Which places did you go to? And that helps you in determining where they could have been exposed, and then you find out who they could have exposed as well when during the period that they were infectious. But when it's widespread, it's much more difficult to determine. For example, when we had our first surge, it was very easy and clear for us to determine that spread was occurring at in private gatherings, because every single time we did the interview, you'd find out, yes, this person went to a birthday party, a funeral, or graduation. But after it was more widespread, it was not that easy to make those determinations. So it is still useful in terms of being able to notify people if they have been exposed. But in terms of determining where the exposure could have occurred, it becomes much more difficult when you have widespread disease in the community.
Is the county getting the same allocation of Pfizer and Moderna vaccines?
It's always a little bit different each week. Yeah, it's never quite the same.
What is the relationship between vitamin D and COVID-19?
So there's some data that suggests that people who have vitamin D deficiencies do worse. Vitamin D is a complicated story. There's been a lot more information about vitamin D deficiency over the last 5 to 10 years compared to previously, and there's been a lot more focus. So get some sunshine.
Do you know the ratio of children under 5 contracting the virus?
It's been very minimal. I think for those children actually less than 17, we have maybe about 10 to 12% of our total cases. So for under 5, it's been very minimal.
Will Sac County make the vaccine mandatory?
There's no intention of doing that.
As of now, is there a timeline for vaccine tiers distribution?
It really depends on when those doses start flowing in, on how many people are in each phase and tier. So it's really hard. I know people would like to know when it's their turn, and they would like to, it would be nice to have a date. We're asking that people be patient, that they continue to take all those precautions that Dr. Kasirye and Dr. Cohen discussed, continue to protect themselves. We're working as quickly as we can, but as cautiously as well. We discussed that before, like really trying to get this right. And so, when we have doses, the more doses we have and the more providers we have, the more quickly we'll be able to move through the phases and tiers. But it will take us longer than some counties because we are a large county.
If someone has low white blood cells, are there any risks in getting the vaccine?
No, in fact, we would encourage people. So I'll just point out that all of the clinical trials do not include people who have low white counts. Anybody whose immune system is is deficient are always excluded from trials, as are pregnant women. But I think we also know that people who have low white counts are also at higher risk for getting more severe disease. And since this is not a live vaccine, there is no added risk to give it to somebody with a low white count. They may not get as good of an immune response, but they will not be hurt by the vaccine, and their risk of getting severe COVID is also much higher. And so it still weighs towards vaccinating.
If you're one of the 4 to 5% for whom the vaccination is not effective, can you repeat the vaccination after some delay period?
That's an interesting question that no one can answer quite yet. There's actually a study that's being designed to look at people who get one vaccine and then end up getting another vaccine to determine whether there's benefit or harm or anything else. So with other viral vaccines, when people don't respond, we often will revaccinate them. I think we're not far enough along in the knowledge base to be able to state that right now.
Why are there 2 doses of the vaccine?
So when the initial evaluation of the vaccines were done, it was clear that when you got a second dose, the antibody levels went way up. And so since what we want are high antibody levels, by giving the second dose, it boosts the immune response and optimizes the protection. That's the basis. That all the clinical trials, 4 out of the 6 or 5 out of the 6 vaccines that have been supported through Operation Warp Speed are 2-dose vaccines. There is one that's a single dose, and I think it's just an attempt to optimize immune response. If you think about it, for older people who get Shingrix, we get 2 doses. For hepatitis B vaccine, we get 3. These are all designed to optimize the immune response and improve the protection.
Before we move on, I was just wondering, Dr. Cohen, you mentioned at the beginning that you were involved in some clinical trials. Are you able to talk about those trials at all?
Yeah, I can mention it. So we're in the midst of doing a study with a vaccine made by a company called Novavax. It is a what we call a subunit vaccine, so it's more analogous to the Shingrix. So it actually gives you the spike protein as opposed to giving you the RNA for your body to make the spike protein. And this is another phase 3, 30,000 patient trial that's being done nationally. It's a randomized trial. A third of the patients get placebo, 2/3 get vaccine. I think there are discussions with the FDA as to how to roll vaccine out to the people who get the placebo once the study is done, if the vaccine works. And so, again, I think the big picture is to vaccinate the entire country. We need more than 2 manufacturers to make vaccine in order to do this in an expeditious way. And that's why the government invested in 6 companies. This is one of those 6 companies. We hope to have the trial totally enrolled. I think the goal nationally is to have it enrolled by the end of the first week in February, so that results can be available in March or April, and then add to our vaccine pool.
Thank you. And I want to be mindful of time. We have a few more minutes, so I'm going to ask our last question of the night. With airplanes having Hepa filters, does that mean it's going to be safe to travel?
So I would say it's definitely safer. Whether it's absolutely safe is not clear, because you're still going to have people sitting right next to you. And the HEPA filters move the air. Again, that increases the number of air exchanges in the airplane. So you're not just sitting there, and it filters the air as it goes through. But if the person sitting right next to you has COVID, that filter in the ceiling doesn't make any difference. And so I think, or while you're in the airport, it doesn't make any difference. So I think that that's why they're mandating masks. That's why some of the airlines are still keeping the middle seat open. I think the plan is to try to minimize that, and then to avoid recirculating virus in the air, they have the HEPA filters in place. So I think they've done the best they can do to make it as safe as possible. It's not going to be perfect, but it's a lot better than it was a year ago in March or in February, after when we were first seeing cases in the United States.
Thank you. And with that said, I would like to, again, thank you all so much for taking time out to join our Sacramento County Public Health Community Forum. We will have another community forum in 2 weeks at the same time via the same medium, Zoom. Again, we thank you for tuning in. Please stay tuned and updated. Liz, if you could share everyone, the Sac County COVID-19 vaccine website. There you could stay up to date and find out more information on what tier. And again, hope you all stay safe and thank you so much for tuning in. Bye, everyone.